Welcome to one more edition of Politics Done Right. I'm here with Dr. Dona Murphey. Donna, how are you doing this morning?
I'm doing okay.
Well, look, folks, Donna is one of Houston's premier activists, doctor, you name it. She is it. In fact, she's given me a quick few minutes before she goes out there and do some more of her activism. What is it that you have to go do right now, Donna?
We have been planning a series of 24-hour vigils across the United States, from San Diego to Michigan to Houston to New York, New Jersey to Maryland, all across the states to demand the release of those who continue to be held in ICE custody, which we've been doing for the past couple of months. We've been, vocally advocating for their release because of their susceptibility to COVID in closed quarters, which is also true for people in the criminal justice system. A lot of overlap. So yeah, we've been planning this action for a little while now, and I didn't want to miss out on it. I myself am sick, but am planning to show up.
Well, that is above and beyond, Donna, because if I'm not mistaken, in March you developed COVID-19. Tell us a little bit about that.
Yeah, so I was exposed to somebody who was working with people in a hospital, and that person became ill, and I became ill. For 28 days, I had a very diverse clinical syndrome. It wasn't just fever and shortness of breath and cough. In fact, it was no fever. I had some dysregulation of my temperature, like hot flashes, but no fever. I did have shortness of breath. I did have cough. I did have pretty profound fatigue and drowsiness, but I also had a rash. I had pretty significant GI symptoms, so some nausea, diarrhea. Yeah, it was not a happy time for about 28 days.
And it lasted a whole 28 days, eh?
Yeah, and I'm the kind of person who typically I get sick maybe once every 1 to 2 years for a day or two. I'm not a sick person.
Wow, that is tough. Well, look, I want to discuss with you some a doctor's perspective on how the country is handling COVID-19. Are we doing what is appropriate right now?
No. The whole purpose of having shut things down at any level was really to diminish the prevalence of the disease. This is a viral illness, which the virus itself does not survive out of the human body for more than a period of days. So if you isolate people from one another, then you decrease the prevalence of the disease because it can't hop from person to person to continue to replicate. And the idea was to make sure that we decrease that prevalence. And by the time we were, going to come back out at any level, we should have ramped up testing. We should have ramped up contact tracing so that for that lower prevalence, we would immediately be able to identify the people who then become sick, the people who were then exposed to those who are sick, and we can quickly isolate and quarantine to contain the disease and further spread of it. And we haven't done that. We have not ramped up. Our testing capacity appears to be on par with, for instance, South Korea, right? It's 1% of our population. However, our testing capacity came online very late. And it also hasn't been very strategic in the way it's been targeted. So there are vulnerable populations that are still not being tested. And the contact tracing is a joke. I mean, the former leader of the CDC and I think of DHHS, they came together in April and mentioned that we needed to, as a country, increase our contact tracing to hundreds of thousands of contact tracers nationally. In the state of Texas, we were hoping to have something like 15,000 to 25,000 people contact tracing. And the governor of Texas has only stated, I don't even know if he's actually done this.
4,000, right?
Yeah, he's only stated that we're going to increase to 4,000 by May 11th, a few days ago. I don't know that that's even happened. So this is a huge problem. I mean, I don't understand what people don't get about this. It's simple science, like you have to be able to test and trace with lower prevalence, because otherwise, if you have it everywhere, then it doesn't really matter that you're contact tracing if everyone has it. But yeah, this is just a disaster.
No, so I imagine then if we keep on the path that we're on right now, we're really in for a very, very dangerous summer and fall.
Yeah, I mean, we continue to see, I mean, we maxed at 1,500 people a couple of days ago in terms of new cases in Texas. I mean, that's the highest that we've seen, right, so far. And I don't think that this is going to slow down if we continue to like do this phased opening as per Governor Abbott. We're going to continue to see many, many deaths. And I think that it's quite clear that those people sitting in positions of power simply don't care.
Now, from a doctor's perspective, how dangerous, you got COVID, you survived. How dangerous is COVID? Or do you think these politicians may be making a bet saying we are willing to lose if it has a 1% mortality rate or 2% mortality rate, maybe we're just willing to lose those people that are gonna die from it?
I think that's quite clear. I mean, the past couple of months, it's been evident that this is killing a ton of people and very quickly, right? So I think you'd have to be a real dummy to think that that's
Right.
not the reality. I think they understand that, and they're willing they're willing to risk those lives.
Now, for those people that are, because there are a lot of people that say generally on the right, and I don't want to make this a political issue because with you I won't. But generally on the right, the people have been convinced that it is okay to go out there. Do you think they would keep that same stance? I know you're around people from all stripes. Do you think they would continue the behavior if they understood the actual death rates and maybe that the people that they're following are taking that as maybe it's okay? Do you think they understand that?
Do they understand the real risk? Is that your question?
Yeah, do they understand the real risk and that the politicians that are guiding them understand the risk and say, yes, we are willing for X amount of you guys to die? Let me give an example. Fox News is out all of the times encouraging people to go out to work, encouraging people to protest, encouraging all these behaviors. However, they themselves are telling their people, we won't be coming back to these offices till June or beyond, which they're saying, for us, we want to protect ourselves. But you guys go out there, work. Do you think they understand that that is what's occurring?
Yeah, that is astounding to me because I think it's definitely out there that disparity exists in what they're advising the general public and what they themselves are doing. My perception is that probably many people who may be espousing that it's okay to open things up, and that, that we should not be required to wear masks, that they may themselves actually still be doing those things, so I don't know why it is this issue has become so politicized. I mean, maybe it's because those of us on the left, I think rightly so, are holding people accountable in positions of power who have failed to make the appropriate decisions for the public. But it should not, I mean, us protecting ourselves and each other, that should not be a political issue.
No, it should not.
It is very frustrating to me, and I don't know. I don't know that it's actually true that people are in large numbers, because we see that in the news, right? But I don't know that it's actually true that people in very large numbers are defying the recommendations of the CDC, for instance, right?
Right.
There has been a lot of confusion, from the top, even from the CDC over the many months. And to be fair, this is a rapidly evolving situation. So I understand some of that. Some of that, I think, has been a function of being politically silenced, having doctors and scientists politically silenced.
Okay, let's stop right there. That's one thing you are not, politically silenced. What will it take? Your peers. What will it take for them to further engage? Because I think you're absolutely right about that. We need the doctors, the people that people actually respect, to get out there and get out ahead of the politics. Why is it that many doctors don't do that? I see you on stage. You're going to a protest right now. Why don't we have more doctors doing that?
I mean, I think most of it is that doctors in general are really occupied, right? They're super consumed by their daily work of caring for patients and all of the administrative chores that come with that, unfortunately. I think that that's really what it is. That's my most generous interpretation. you know, being a doctor it's committing to a life of service. I think for most physicians, for many
Yes.
physicians, it is. And I think a lot of people who are in that realm, you kind of burn out on doing advocacy otherwise, because it's such an intimate part of what you have to do every day for your patients. So they know the system is broken. They know very intimately the system is so broken, but they don't have the time or the energy to devote to changing that system. And I also think that the culture of medicine, I mean, we kind of learn to take it.
Right.
Just take it, you know? And it's medicine is very hierarchical. I don't think it is a discipline that encourages people to speak out against authority at all. So I think all those reasons, yeah.
That makes sense. Now let's really quickly migrate into healthcare now and what's occurring. You know what it's gonna take with, you know, the amount of people that are gonna hit the healthcare system. You know, because we have a lot of people hitting the healthcare system, insurance is gonna be hit hard. Hospitals are gonna be trying to recover money because you notice the emergency room was empty or not very full. You notice that a lot of elective surgeries are not getting placed. So right now we are in a financial dilemma for hospitals because they're not doing a whole lot of services, and for insurance companies because the services that they're doing will cost a whole bunch of money. What is the ultimate solution of our healthcare system? How to provide it, how to lend it? The people in England, the people in the UK, the people in France, Sweden, and all of them. Sweden never closed, but why? They have healthcare for everybody. Nobody's going to worry about being bankrupt. What is our solution, Donna?
Yeah, this is a very difficult problem because I think that the transition will be very, very painful. Moving from what I think is essentially a for-profit healthcare system in the United States, although we do have public options here, right? Moving from that to what I think we should be doing, which is investing very heavily in public health and prevention, for instance, and in publicly funded healthcare, is going to be, I think, a difficult transition for this country, but I think it's one that is absolutely necessary. And I hope that people see that in this moment, that because we don't have a system in place that values prevention over acute treatment, which we don't even have for COVID, right? That they would be moved to support a transformation of the system, right? Just to completely do it over. I mean, I've never felt so committed to that. I mean, I'm in industry myself, right? Like my job is in working for a diagnostics company. And it's going to be, I think it's going to be a shock to the way we do medicine right now. But I think it's absolutely necessary. And I think it's absolutely possible to do. It's, you know, I've been talking about pivoting towards a public health economy, right? So that everything becomes about prevention as much as possible. I mean, we still are going to have acute illnesses that we're going to have to treat, right? But right now, I think we're so motivated, our system is so motivated by acute therapies that are really expensive, that are in large part not very evidence-based, honestly. I mean, it's very, very thin evidence for a lot of the interventions that we do, which also have, you know, cause what we call iatrogenic injury, meaning we in healthcare are injuring people by doing some of the therapies that we do, right? But somebody is profiting. So we're motivated to keep doing it, right? We're motivated to keep treating people with those drugs that have a million side effects. We're motivated to keep treating people with the, you know, or using medical devices, for instance, that are not very well vetted, right? Because somebody has money to make at the end of the day.
I mean, that is a magic that you just said. If there's an incentive to make money to push something, just like the president was pushing hydrochloric, you know what?
Yeah.
Right. Just like he was pushing that. Again, that is the issue. I am never sure. You know, my sister is a doctor as well, and you know she supports exactly what you said. We need to have this stuff publicly funded and try to mitigate profit. I'm not saying that there can't be profit, but it has to be mitigated in such a manner that the profit motive is solely there to create real innovation. But when it comes to the interface between healthcare and the community, it probably should be public, don't you think?
Yeah, I think it's really simple here. If we change the way we thought about healthcare as being fundamentally patient-centered, right? What is best for the patient and their families? Then I think we would understand that, you know, we shouldn't be pushing interventions that are not well vetted, and that have a lot of, you know, other effects, right? These decisions should be made in shared partnership with patients. And I think at the end of the day, that's going to look like a system of prevention, and, you know, health and well-being in general, and not like acute therapies to address chronic issues that are there only because we did not educate people. We did not provide them with the preventative, you know, preventative care to prevent the illnesses, chronic illnesses from emerging. I mean, it's because we are more profit-centered, we end up, and it's almost secondary, right? The care of the patient is secondary to the profit that we can make. Then we always think about how we can cut costs, right? Like, and that is a disservice to the patient ultimately. But if we think first and foremost the patient, then of course we can also think about how do we also make money in this, right? Yeah, I don't know.
Well, Donna, let me tell you, first of all, you're my hero. I mean, that you're going out there and you're doing what you're doing, that you're keeping the pressure on. Thank you very much for what you're doing. Your activism is necessary. We just need a hell of a lot more of you. So please replicate yourself like a virus, and in a positive manner, that is. So anyhow, in closing, please tell our audience what they should be doing going forward politically and health-wise.
Yeah, so, you know, it's November 2020 that we have, you know, a really critical election coming up. And I think that this crisis has demonstrated to us how critical it is to have the right people in office making decisions that have huge implications for the public. So I think people should be thinking about, you know, definitely getting out the vote for themselves, to protect yourselves. I think as everybody is opening up, if you are so privileged that you are not forced to go back to work, I think that you should, yeah, I mean, just you stay at home as much as you can. I think universal masking is right to prevent the spread of this illness. Advocate as much as you can within your community with local officials and state officials, because our federal government seems to be completely non-receptive to doing the right thing about increasing testing and contact tracing in our communities.
Dona Murphey, Dr. Dona Murphey, thank you so kindly for speaking to us. Your words mean a lot. Have a wonderful day. And when you go out there to do that activism today, please keep that mask on tighter, and please take care of yourself. We don't want you with another episode of something else. Thank you very much, Donna.
Absolutely. Bye-bye. Thanks.
I'm Egberto Willies, host of Politics Done Right, an independent news program. I post several news videos of interest every day. I ask you so kindly to subscribe to my channel, and please leave me some comments. Thank you very much.